Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee. Currently, I'm a district activist and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your questions and comments on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, answering those questions and connecting you to resources. Did you know that with rare exception, you have one chance each year to make a change to your health insurance plan? The annual open enrollment period is around the corner, and during open enrollment, you have an opportunity to do your research, understand your options, and enroll in the health insurance plan that offers the best coverage for the services and medications you need at the lowest possible cost. National MS Society MS Navigator Nicole Vasquez is joining us today to explain all you need to know about open enrollment and how MS Navigators can help you find the option that works best for you. Welcome, Nicole. Thanks for joining us today.
Of course. I'm so happy to be here. Thanks for inviting me, John.
Being enrolled in a health insurance plan is a major step to get the healthcare services that someone needs. Nicole, maybe you can start us off by explaining what are the main sources of health insurance?
Right. So the biggest bucket of health insurance coverage comes from group coverage, what you would get as a benefit of employment or a partner or spouse's employment. Then the next bucket is going to be individual coverage, something that you would pick up on your own from, say, the marketplace. And then the last bucket is going to be government programs like Medicare, Medicaid, VA benefits, those sorts of coverage options.
What should people be considering when they choose a healthcare plan? And are there specific considerations that people living with MS should be aware of?
We definitely want people to check in on their specific needs. Things like, are your preferred doctors going to be covered? Are your medications going to be on that list of drugs that the plan covers? That list is called the formulary. If you need infusion treatment, what does that coverage look like? Another thing, are MRIs covered and at what level?
We heard from Sebastian, who told us that he lives with MS and he's on an MS disease modifying medication. He told us he's also being treated for hypertension and diabetes. And Sebastian's wondering if he needs to check the list of covered drugs before he selects plan. And he wants to know what his options are if one or more of the drugs he uses is not covered.
Right. Definitely make sure your medications are going to be on that formulary, the list of covered drugs for the prescription drug plan for any coverage that you're considering. If you do have a medication that's not on that list, there are a variety of options that you can look at. One common restriction is step therapy. That would take some support from your doctor. And then there's also the option to appeal any denial of coverage for drugs that may not be on that formulary list.
When choosing a health insurance plan, is it important to determine which doctors are in network? And I guess more specifically, how can someone check to see whether their doctors are in network?
Right. Well, first, in network, for those of us that are like me that have trouble with remembering terminology, in network means that the plan and the provider have shook hands and agreed to work together for that year. And so what we want individuals to do, if you want to make sure that you're not only your neuro, but your primary care doctor, your PTs, anyone else that you see for medical care is in network. And what we suggest is contacting that health insurance plan specifically to see if that provider is still in their network. And also to really make sure you're checking all bases, reaching out to your providers to check with them as well and make sure that they're going to accept that plan for the next year.
Open enrollment doesn't last long, but the decisions people make over this relatively brief period of time, well, they have a significant impact on the healthcare someone's going to receive once the year begins. First, Nicole, why don't you explain what open enrollment is and then why it's so important?
Right. So open enrollment is this one time of year that you are able to re-sign or sign up for a one-year contract with your health plan. It's going to expire again at the end of the year. So you have the opportunity to continue with the named plan that you already have, or maybe switch to another option or another plan or provider even. Some risks that people can look at or consider during open enrollment or facing open enrollment is just kind of letting it be, assuming that just because the plan you had last year worked, it's going to be the same thing for the next year. Plans are going to change almost consistently from year to year. And sometimes those changes you never notice and they don't impact you, but other times they can have a huge impact.
Well, thanks for mentioning some of the risks that people could face. Let's look at the flip side. What are some of the rewards for making well-informed decisions during open enrollment?
So you could end up making a change or understanding your plan better and getting better coverage. The negative, if the plan isn't going to have that same coverage or as good a coverage, you're going to be able to be prepared for any changes and that can't be avoided.
Tell me, what are the open enrollment dates this year?
So for your group coverage, those big plans, that first bucket, it's going to vary depending on the employer. Every employer is going to have a different open enrollment period. Marketplace, those individual coverages, for most states, it's going to start on November 1st and run through January 15th. But the thing to remember with that one is that if you want your coverage to start on January 1st, you have to be enrolled in your individual plan by December 15th. Okay. Also, the states that run their own marketplaces that don't use the federal marketplace, they may have a longer open enrollment period and some more options as far as those dates go. And finally, Medicare open enrollment is going to start on October 15th and end at midnight on December 7th.
Are there special enrollment periods?
Yeah. If you change employers, you'll get a special enrollment period. If you move, Medicare and a lot of the other programs will give you a special enrollment period. So life events can have an effect on special enrollment for you. The marketplace has added some subsidies. So income may allow you special enrollment periods with the marketplace as well as with Medicare. And Medicare has all kinds of fun, funky rules that can allow you to change your Medicare Advantage plan choice or opt out of something that you have chosen. But those are a lot of ifs and buts. So give us a call and we will help you look up those rules and regulations before you make a decision.
Well, I've heard you mention those marketplaces a couple of times, and Carla contacted us. She said she's moving, and she's wondering if there are some states that don't use the federal government healthcare marketplace and instead run their own healthcare marketplace. Now, I think you've already started answering this question, but hopefully you'll be able to give Carla the information she needs.
Yes. There are states that are going to run their own marketplace and have a little bit different look and rules and regulations to it. So the easiest way to figure out how to get that health insurance information is by going to healthcare.gov. There's going to be a link on there that literally says find local help. And you're going to click on that link and you're going to put in your information for your location, and it's going to tell you where to go to look for health plans.
Dave wrote us asking, when will changes to his plan actually take effect?
Changes to his plan will take effect on January 1st in the vast majority of situations.
We heard from Jawan, who asked what happens if he changes his mind after open enrollment has ended. He wants to know if he can change his health plan selection then.
In most situations, no. Most situations, you're in that contract for the next year, but give us a call. We'll look at the ifs and the buts and figure out if you have an alternative option.
We heard from Pamela, who's wondering if she's not going to be making any changes to her current health plan. Is there any action she needs to take during open enrollment?
I would say or suggest that even if you don't plan to make any changes, we still want you to dig in to that plan and that coverage for what it's going to look like next year to make sure that even though you're not making changes, the plan isn't implementing any unexpected changes on you.
You've already brought up Medicare open enrollment a few times during our conversation, and it's important. Hundreds of thousands of people living with MS are on Medicare. So what services are offered during Medicare open enrollment?
Yeah, so Medicare open enrollment, we offer a special service starting as of October 15th and running all the way up until when open enrollment ends. We, as Navigators, the Benefits and Employment Specialty Support Team, is going to offer one-on-one personalized plan searches. We get together with you after we make an appointment over the phone, and we use a Medicare.gov plan finder tool to help you understand your options better and make an informed choice for the next year.
Who can take advantage of Medicare open enrollment? Is this something that's only for people who are already on Medicare?
Yep. So anybody that has previously had Medicare coverage can call us and set up one of these appointments, and we'll do the plan finder search tool with them and narrow down plan options. For individuals that are soon to be on Medicare or maybe even aren't starting their Medicare coverage until January 1st, you actually have a different enrollment opportunity right now. You have more time than this brief open enrollment window. So we will still help you and set up support for you. It's just not one of these appointments because you are not considered open enrollment. You've got more opportunity and more time than the individuals that already have their Medicare coverage in place.
While we're talking about Medicare, can you walk us through the Medicare benefit structure?
This is a fun one. Medicare is a huge puzzle with different solutions for different people. So it's good to have options, right? But it's also pretty overwhelming. So I'm gonna try and do this quick, okay? And anybody that needs more help with us, just give us a call. We're more than happy. So I consider Medicare to have three main parts. You've got Medicare Part A. Most people you'll hear refer to this as hospital coverage. I think it even says hospital on your card. It's better to think of this as inpatient coverage, okay? And then we'll skip the big part and go to Medicare Part D. D for drugs. These are prescription medications that you handle yourself. You give to yourself. You'll go pick up at the pharmacy or mailed ordered and ingest into your own body, right? Anything that's not an inpatient coverage service or a prescription drug that you give to yourself, it is covered under Medicare Part B. Medicare Part B is the coverage for all medical care that's not an inpatient stay or a prescription drug that you give to yourself. So with original Medicare, with those A, B, and D, you can also pick up what's called a Medigap policy or Medicare supplement, and it kind of helps fill in the gaps in Medicare Parts A and B. And then, or you can take a completely different route and get Medicare through a privatized version. Those are called Medicare Advantage plans, or also referred to as Medicare Part C. Those Medicare Advantage plans, again, are privatized versions of Medicare, and they'll have a lot more variety to their coverage too.
Can you spend another minute, because I know this is something that confuses a lot of people.
Yeah.
Can you kind of explain the difference between what's called original Medicare and Medicare Advantage plans?
So Medicare Advantage plans are essentially, like I said, a privatized version of Medicare. So health insurance companies that we're all familiar with that will offer private insurance or group coverage will come to Medicare each year and lay out what they want to offer as alternatives to original Medicare. And if these plans are shown to have equivalent coverage as a person would have if they just had original Medicare, those A and B parts, then they can sell their plan as an alternative to Medicare called a Medicare Advantage plan. A lot of these Medicare Advantage plans will also tack on bells and whistles too to entice you to enroll in their policy. Things like dental coverage or gym memberships or those sorts of things to help people, to entice them to come into a plan that may have more restrictions on it than original Medicare. So it's a quick summary. But what we can do with our open enrollment calls, our open enrollment appointments with individuals, is we can help you assess and narrow down those Medicare Advantage plan options, as well as, if you want to stick with original Medicare, those standalone Part D plan, drug plan options.
I noticed that during open enrollment, we see a lot of television commercials, and they're all really advertising these Medicare Advantage plans as opposed to original Medicare. The National MS Society's MS Navigators can help people affected by MS navigate their way through the open enrollment period and make the best informed choices. So here's a real important question. How can people reach an MS Navigator?
So easiest way is to call 1-800-344-4867. It also is 1-800-FIGHT-MS. You can also go to our website. We have a chat feature on our website. Those opportunities are available Monday through Friday from 8 a.m. to 5 p.m. Mountain Time. Or at any point in time, you can email us at contactus@nmss.org.
And what can people expect when they contact an MS Navigator?
Sure. So one of our lovely intake specialists is going to answer your call. They're going to ask you a few questions. They're going to get you directed to the right person by asking you those questions. If you are going to call and ask for an open enrollment appointment as a Medicare beneficiary, then what they'll do is they'll transfer you over to one of our team members. And at that point in time, we will talk to you about some dates and times to set up an appointment so we can call you back and do that Medicare Plan Finder search.
Tricia wrote us asking if Navigators can help people make their way through the health insurance marketplace website.
We have found that the best way to get help with that marketplace website is to go to the website that I mentioned earlier, healthcare.gov, and there is a link, Find Local Help. And with that, you can put it in your location and it will come up with some options for navigators or brokers or assisters that will have specialty knowledge about the marketplace or plan options in your specific area. We
What?
also
I'm
have,
sorry.
we also have on our website, we've set up a self-service tool, and it's all about open enrollment. Give some really good documents that help you kind of look and assess and evaluate your options. And that is on our website, nationalmssociety.org/open enrollment.
Well, beyond that helpful tool, what are the ways that MS Navigators can provide assistance during open enrollment? For instance, can an MS Navigator help with a personalized plan search?
Yeah. For the marketplace, for Medicare, yes, we can do a personalized plan search using the Medicare.gov tool finder, our plan finder, and some information from you to make it more specific to you.
And that brings me to my next question. What are some things MS Navigators can't help with?
I think probably one of the biggest questions we get is from individuals that are asking for help to assess a particular health insurance company or policy based on the big open question of whether or not this so-and-so plan is good for people with MS. As we know, everybody with MS is so different as far as their personal preferences, their medical needs, their prescriptions that they're taking, comorbidities, all of those sorts of things. So what we want to do is we really want to focus on being able to answer or give a person information to be able to make an informed choice on what plan is best for you, not an overall MS answer.
Well, here's another question that I know you've already started to answer, but I'm hoping you'll share some available tools and resources that people can use to help them make the best health insurance plan decisions.
So what we have is first, again, I would go to that nationalmssociety.org page /open enrollment. That's going to give you some documents and some tools that you can use for any health insurance options that you're looking at. There's also then, once you kind of decide on what plan you want, there is another really good resource, another self-service tool on our website, nationalmssociety.org/RX help. And that's going to give you financial assistance resources and funding options and all that information for disease-modifying therapy or MS-related prescription help. And then if you need to take a step back and be able to make sure that you are accessing the right source of health insurance, we have a really good page, again, nationalmssociety.org/get covered. And that's going to give you information about all of the health insurance options that are out there.
You've shared some important and very timely information with us today. What would you say are the top 3 takeaways that you'd like our viewers to remember?
Pay attention to dates. Really, this is a short time frame for us to be able to look at our options, and we don't want you to miss a chance to be able to take more control of your health insurance coverage and your health insurance over the next year. Don't assume that what you had last year can't get better or couldn't get worse. Ask questions and check in on those benefits just to make sure that you're understanding what you've got there as options. Honestly, the last one, don't feel bad about being intimidated. Don't feel bad about getting frustrated. No one has a crystal ball to be able to say what you're going to need or what medical interventions may be necessary in the next year. And so we want to help you understand and be there to help you to make an informed choice about what coverage could look like for you next year.
Well, thanks for sharing your expertise with us, Nicole. I think we have time to handle a couple of additional questions from our audience. Okay. Brianna wrote that she was hired 2 months ago and she signed up for health insurance with her new employer. Now, Brianna wants to know if she has to do all of this again next year.
Brianna, sorry. Yes, you will. It may it may not be as difficult because you already have that foundation of knowledge about what your employer's health insurance plans tend to look like. But yes, you do need to double check and make sure that you're assessing your options and making an informed choice for next year.
We heard from Maria, and Maria told us she doesn't have a computer and wonders if there are other ways that she can enroll in Medicare.
Yes, absolutely. So once you decide on what you want to do for your coverage, there is the option or opportunity. You can contact Medicare.gov and they can enroll you over the phone. You can use a broker. Many brokers and insurance agents across the country have the ability or will enroll individuals. You need to make sure that that broker is going to have access to the policy that you want to sell it. And you can also contact your local SHIP, which is your state health insurance assistance program. And the SHIP information is on the Centers for Medicaid Services website at cms.org.
Ronald contacted us and he wants to know if he can get Medicaid if he has MS.
Yes, he could, but Medicaid is not going to be the only determining factor as to whether or not you're eligible for Medicaid. You will have to meet a certain income threshold criteria and asset threshold criteria. So certainly you can give us a call and we can talk more about it. Probably the best way to determine if you'd be eligible for Medicaid in your state, because it is a state specific program, is to contact your Medicaid office and get the information from the horse's mouth.
Well, I want to thank everyone who submitted questions and thank you for being with us today, Nicole.
Yeah, of course. Thank you.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. And as Nicole mentioned, you can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups. You'll see ways that you can get involved and you'll hear about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Nicole for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Nicole Vasquez and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.